Hello everyone, and once again, welcome to the Physio tribe. My name is Samantha David, and I'm a practicing musculoskeletal physiotherapist. This is the first part of the 4-part series on clinical reasoning and critical thinking. Before I go ahead with this video, I'd like to just extend my gratitude and appreciation to the pioneers in this field, and they are Ian Edwards and Mark Jones. I'd encourage you to have a look at the resources in the description from where all the content of these videos are taken from. So coming back to what are we going to talk about? So the two main questions we're going to cover today is clinical reasoning and why is it important to have sound reasoning skills. So what is clinical reasoning basically? So as clinicians, I think we are exposed to a lot of information that we receive from our clients on a daily basis. And that goes beyond just understanding, their physical impairments and what they tell us, but also about the environmental factors and psychosocial factors that are related to their health. So then the question is, what do we do about this information? So loosely related to the textbook definition of what clinical reasoning is. It is basically a method of inquiry which is related to self-reflective thinking and involves a decision-making process, with the main goal being the management of the patient. So the 4 things that I've got from what exactly clinical reasoning is first, it's a method of gaining information or inquiry. And we do this in collaboration with the client. Second, what do we do about this information? So it's a way of analyzing and processing this information. So a self-reflective process again, which has few steps that we're going to talk about. The third, it's done within a biopsychosocial framework, which means it always goes beyond and extends beyond the diagnosis. It involves understanding the narrative, the story of the client, of the patient, and goes beyond understanding only the problem, but understanding the patient as a whole. And lastly, we do this with the main goal to deliver the best evidence-based practice for the person in our care. So all in all, that is clinical reasoning for you. Obviously, it has a lot of steps and strategies that we're going to talk about in the coming videos. But moving on to the next question, why is it important to have sound reasoning skills? And that's because we have human biases that can affect our judgment and thereby cause a bit of errors in the way we, come to conclusions. Now, what are these errors or what are these biases? We'll talk a little bit about what our thinking systems are. So we have 2 systems in place, system 1 and system 2. System 1 is basically our first impressions, intuitions. It's automatic and it's fast. Now, the thing about this is that most of our errors come from your first system, if it's the only one that is, in play. System 2, on the other hand, is your slow, time-consuming, analytical process. So let me give you an example of system 1. So consider this example and take a few minutes to think about it. So if there were 5 machines that made 5 widgets in 5 minutes, how long will it take 100 machines to make 100 widgets? Now, the first thing that came to my mind was 100, but I was very wrong. So I'll get you to think about that one and find the answer. But that is what system 1 is for you. Now, the thing is, you've got to understand that system 1 and 2 work together, and they both are important. But as we know, research tells us that, experts are really good at basing most of the decisions on first impressions. That is, they pick up cues, recognize patterns at the very first go. Now, they do that mainly because, obviously, of experience, but also because they've trained their system they've studied their clinical reasoning over and over and over again, which has helped them then recognize these patterns. And that is exactly what we need to incorporate in our thinking process. So going back to what these biases are. So a few of the biases that one needs to be aware of, that we subconsciously might be attracted to or would involve in our thinking would be the first one, which is a confirmation bias, which means we have this provisional diagnosis in our mind and we only collect data through an objective assessment that will confirm this diagnosis, which is actually wrong. Second is memory bias, which means we probably have had a very spectacular outcome with our past patients, and we end up using that over and over again because of a successful outcome, which is again a bias. So it's gonna be wrong if that's the only thing that's used over and over again. Third is your stickiness, which means we again have a hypothesis and we don't end up refining it as we go further into our assessment process. And the first one is priming influence or prior information, wherein we base most of our decisions based on a prior diagnosis made by an expert or imaging findings. So these are few biases for you to think about. But what I want you to do is, before we talk a little more about the different strategies and categories in clinical reasoning, is have a thought about what your reasoning process is like. Have you ever thought about the way you think about your thinking? And if not, think about it and look forward to sharing the rest of clinical reasoning with you. Now, like us on Instagram, Facebook, subscribe to our channel and leave your comments. We encourage you to do that.